You know, if you just randomly survey people and you ask them, what are some of the diseases they worry about? They're always going to talk about heart disease. They're always going to talk about cancers. They're going to talk about strokes and brain problems. But hardly anybody talks about bones, osteoporosis. And it's actually a critical issue because did you know that by age 50, 55% of Americans will suffer from low bone density? And this is a major problem. When your bones aren't dense and strong, you could fracture. And when you fracture, there is a significant mortality rate to this. My name is Dr. Michael Smith, and today's title, My Weak, Brittle, and Tired Bones. The National Osteoporosis Foundation makes some recommendations to keep your bones healthy. They recommend that you take in enough calcium and vitamin D on a daily basis, that you do some weight-bearing exercises, definitely don't smoke, and don't drink too much. We just don't think it's enough. At Life Extension, we have developed a more innovative approach to keeping your bones healthy. Now, before we get into Life Extension's innovative approach, let's talk about what low bone density really is. It's called osteoporosis. It's porous bones. Literally, there's like pores in your bones. There's missing minerals. That makes your bones weak and fragile. The problem? You could fracture. And here's the thing. When you fracture a bone in your body because of osteoporosis, there's a 20% chance within 1 year you could die. Some of the traditional risk factors for osteoporosis include being a woman, being older, having a significant family history, meaning maybe your mom has osteoporosis, being small and thin, and then being Caucasian or Asian. Now, the way we diagnose osteoporosis, or low bone density, is with a bone density scan. The most common one out there is called a DEXA scan. This is kind of like a fancy x-ray machine that can really look at the minerals in your bones. There's 3 scores that you'll receive with the DEXA scan. One is called the bone mineral density, another one is called a T-score, and another one is called a Z-score. It's the T-scores that most doctors look at. Based on those T-scores, you can get a diagnosis of low bone density or osteoporosis. But at Life Extension, we take it a step further. There are some labs that you could also do that would help your doctor to make that diagnosis or maybe even follow the treatment for osteoporosis. One is called the DPD. This is actually a urine test. Another one is called osteocalcin. And the last one is called the parathyroid hormone. When these are elevated, either in your urine or your blood, that tells us that maybe you have too much bone turnover, or your bones are getting weak, or you're losing the density. Now let's learn a little bit about Life Extension's innovative approach to improving bone health. The first part is bone density. This is made up of certain minerals and certain vitamins. Starting with the minerals, the main one, of course, is calcium. Now there's something I want to make clear to you. It is important for you to get a certain amount of calcium every day. There is some misinformation out there that supplementing with calcium could cause that calcium to get deposited in your arteries, for instance. And that's just not true. What we believe at Life Extension is that when you don't supplement with enough calcium, that's when you get the problems. Your body has to keep calcium in a certain level in the blood. And if you don't have enough, it has to get it from somewhere. And if you don't supplement with it, it's going to take it from the bones. So we want you to get calcium every day. If you're a woman, 1,200 to 1,500 milligrams a day, and a man, about half of that. Now also realize, too, that calcium comes in a lot of different forms. And there's a lot of debate on which forms are best to use to get the full absorption from those supplements. We believe that there are 2. One is called dicalcium malate, and the second one is called calcium bisglycinate. These seem to be the best forms to use in a supplement. Now don't forget about estrogen also. Estrogen plays a major role in keeping bones healthy and keeping that calcium in the bones. So check your estrogen levels, especially in women. If you're estrogen deficient, you might want to talk to your doctor about appropriate hormone restoration with estrogen. Now the next mineral is called magnesium. This is a big one. Magnesium is actually involved with about 300 critical reactions in the body, including keeping your bones healthy. Did you know that there was one study that showed if you simply supplement it with 100 milligrams a day of magnesium, you could increase your bone density by 2%. That's pretty significant. Now, the next two minerals are ones you may not even realize. One is called silicone. Silicone is very important to increasing the cells that make bone. Lastly, for the minerals, there's boron. Boron is another often overlooked mineral that's involved with hundreds of different types of reactions, and one of them is keeping your bones healthy. Now, boron is hard to absorb, so at Life Extension we focus on a certain form called osteoboron, which has been shown to absorb quite readily in a good supplement. So I know that was a lot right there, so let me summarize real quickly. You got calcium and magnesium. Now, we all know about those basically, and they are critical for keeping your bone density healthy. But don't forget about the last two I mentioned, silicone and boron. Silicone increases those bone-forming cells, they're called osteoblasts, and boron helps to stabilize the density of your bones. Now, the second part of bone density are those vitamins, and specifically there are two of them. These important vitamins help to put calcium into the bones. The first one's vitamin D. Now, vitamin D is just so important for so many reasons. It's been in the media, and it should be. So supplementing every day with vitamin D is critical. But the one I want to focus on is vitamin K. This one is often overlooked, specifically a form of vitamin K called K2. In the Journal of Orthopedic Science, it clearly showed that vitamin K2 by itself can reduce the risk of fractures, for instance. So supplementing with about 45 to 100 micrograms a day of vitamin K2 is critical for bone density. Okay, so now you learned about minerals and vitamins that are critical to bone density. And that's the first part to the innovative approach for improving bone health. The second part is bone strength. And this is what medical doctors and a lot of people just don't even think about. Just because you improve the density of a bone, it does not mean that that bone is strong. Did you know bones are flexible? And it's that flexibility that gives bones strength. Now, the key to that flexibility or that strength is a connective tissue protein called collagen. Yeah, you've probably heard about collagen. It's all over the place in your body. It's in your skin, it's in your hair, it's in your joints. It's also in your bones. And it gives bones power and strength to resist pressures. But there's a problem. If you just start supplementing with collagen, it may not go to your bones. The body might put it in the skin, might put it in the joints, might put it in your hair. Because remember, it's all over the place. So the scientists from Tokyo University came up with a really cool formulation. It's known as a collagen mineral chelate complex. What they basically did is they took the collagen and they wrapped it in the minerals that are important to bone density. So now the body takes that complex with that collagen, and guess what? Puts it in the bones. It's a great finding, and it's what we focus on to improve bone strength here at Life Extension. Now, there's one more thing that you could do for bone strength besides collagen, and that's to use a plum extract. Studies have shown that plum extracts, when they're mixed with that collagen chelate formula, it really ramps up the strength of your bones. Now, everything we just discussed is so important. You must remember that the health of your bones is a critical issue you have to address. At Life Extension, we have an innovative approach that focuses both on bone density and bone strength. Bone density is about the calcium, the magnesium, but don't forget about silicone and boron and vitamin D and vitamin K2. You must supplement with those vitamins to support that bone density. And then on bone strength, you got collagen and plum extract. Bottom line, the health of your bones is a critical issue. It's overlooked, and we need to focus on it. My name is Dr. Michael Smith. Thanks for watching.